नागाननाय श्रुतियज्ञविभूषिताय गौरीसुताय गणनाथ नमो नमस्ते कर्पूरगौरं करुणावतारं संसारसारं भुजगेन्द्रहारं सदा वसन्तं हृदयारविन्दे भवं भवानी सहितं नमामि या कुन्देन्दु तुषारहार धवला या
Subrava
शुभ्रवस्त्राव्रता या वीणा वरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्मा च्युतशङ्कर प्रभृतिभिः देवै सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापः सर्वमङ्गलमाङ्गल्ये शिवे सर्वार्थसाधिके शरण्ये त्र्यम्बके गौरी नारायणी नमोस्तुते आविर्बभूव कलशं दधदर्ण वाद्यः पीयूषपूर्ण ममरात्वकृते सुराणां रोगजालजीर्ण जनताजनितः प्रशंसो धन्वन्तरिच भगवान् भविकाय भूयात् श्री धन्वन्तराय नमः। ओम शांति। On behalf of Imami, Jhandu, Independent Research Ethics Society and Vishwa Ayurveda Parishad, I would like to welcome all the speakers. Pranam Dr. Shetty, my brother Dr. K.K. Dwivedi ji, Dr. Vishnu Prasad Sharma ji, Dr. Sadanand Patri, MME Hyderabad, RSM Hyderabad, Dr. Arun Kumar Chaube. The theme for what we are here, people will join definitely, and this will be live on YouTube. So everybody can take benefit of our motivational speeches, our scientific speeches, anytime, as and when he required or he is interested. We thought that every day is being celebrated by 3 or 4 names. Every day. Something UNO has decided, somebody where WHO has decided. But we have only one day, Ayurveda Day, Dhanvantari Triyodasi. So it was, I thought that it is not fair with Ayurveda. So we should celebrate every day, whatever day is related with health, technology, motivational, inspirational, we will definitely share. We will make YouTube video. We will involve persons, more and more persons. This is our first year. When we will be repeating these days next year, definitely a seed will be sowed for Ayurveda promotion internationally. I would like to communicate my sincere thanks and regards to all speakers who have accepted our proposal within very short period. I would like to start this session by inaugural speech of Dr. K.K. Dwivedi ji. I would like to request Dr. K.K. Dwivedi ji for his motivational speech as inauguration of this session. Dr. K.K. Dwivedi ji is Professor and Head of the Department, Ayurvedic College, Government Ayurvedic College, Varanasi, and we are fortunate to have him. He is member of Board of Governors, CCIM. So I would like to welcome Dr. K.K. Dwivedi ji. After his ill health, he is with us. Thanks for joining, sir. Dr. K.K. Dwivedi.
आदरणीय पवन शर्मा जी, आज के हमारे प्रमुख वक्तागण बड़े भाई डॉक्टर बीपी शर्मा जी, डॉक्टर अरुण जी, डॉक्टर शेट्टी जी, डॉक्टर जोशी जी और इस में जुड़े हुए हमारे सभी श्रोतागण, विद्वानगण, ये बड़ा ही सौभाग्य का विषय है कि हम अपने इस कोरोना काल में अपने समय का उपयोग एक दूसरे के ज्ञान का परिवर्धन करने के लिए एकत्रित हैं। हमारे आयुर्वेद शास्त्र में शरीर और मन दोनों अलग से नहीं कहे गए हैं, यानी दोनों एक साथ होकर के ही किसी रोग के उत्पत्ति में कारण या उसके वर्धन में सहायक होते हैं। संभवतः इतना सूक्ष्म रूप से हम शरीर और मन से जुड़े हुए रहे हैं कि इसकी आवश्यकता नहीं समझी गई कि शरीर अलग है और मन अलग है। आधुनिक चिकित्सा विज्ञान साइकेट्री को अलग करता है और उसके पीछे वजह भी थी। वजह ये थी कि अलग करने से उसका ज्यादा डेवलपमेंट हुआ। लेकिन आज भी मैं महसूस करता हूं कि जो भी मरीज आधुनिक चिकित्सा विज्ञान की औषधियां लेते हैं, वो कहीं न कहीं से लाइफ लॉन्ग इनएक्टिव रहते हैं, किसी न किसी पार्ट से इनएक्टिव रहते हैं। These are the side effects what we can say of that particular disease. You can see in each and every disease, either it is schizophrenia or it is depression or it is something else. So only Ayurveda can give remedy to these fellows, और यही अगर पालन किया जाए पूर्ण रूप से तो हम समझते हैं कि नॉर्मलिसी की तरफ, क्योंकि लक्षण दबाना अलग चीज है और नॉर्मलिसी की तरफ आना अलग चीज है। फिर नॉर्मल लाइफ कैसे हम आगे करें, ये सबसे बड़ा संदेश अपना आयुर्वेद देता है। मैं समझता हूं कि आज इस मानव स्वास्थ्य दिवस पे हमारे वक्तागण हम लोगों को फिर से एक बार उन पुरानी चीजों की याद दिलाएंगे, अपने नए शोधों से हमें अवगत कराएंगे और अपने स्वस्थ होने के साथ साथ भारतीय जनमानस में आयुर्वेद की उपयोगिता को सिद्ध करेंगे। इन शुभकामनाओं के साथ आप सबका एक बार पुनः अभिनंदन, बारंबार प्रणाम, नमस्कार।
Thank you, sir, very much. Thank you very much for your motivational speech. Now I would like to invite Dr. Suhas Kumar Shetty, very famous in mental health, Professor and Head, Department of Manovigyan एवं मानस रोग, Dean R&D, SDM College of Ayurveda. He is well renowned that I have received 10 or 15 recommendations for you, sir. On this subject, you are authority. We would like to learn from you now, because in our Eastern India, there is no department of this Manas Road. It is very unfortunate. So please guide us. We would like to welcome you. Thank you. Please, Dr. Swasthya Shetty.
Slides are visible?
Yes.
Yes. So very good evening to all of you. At the outset, let me thank the entire organization, especially the Independent Research Ethics Society, the Imami Zandu, and the Vishwa Ayurveda Parishad, and especially my pranams to Dr. Pawan Kumar sir for inviting me and giving me an opportunity to share my experience in the field of Manas Roga. And my salutation to all my co-speakers, especially the senior guru, Dr. A.R.V. Murthy sir, and my friends and colleagues, Dr. Dinesh and Dr. Vijayendra Bhatt. I'm very happy to share the dais with to all these people. And at the outset, let me once again appreciate the effort that has been taken by the Independent Research Society under the leadership of Dr. Pawan Kumar, who have been celebrating various days. And I think this is one of the 138th such webinar being organized by them. I really acknowledge them and appreciate them for all the hard work and wish them that they cross many, many more in the future. And I'm very thankful that they have taken a very important aspect of mental health, which is generally neglected by many of the people, and so is by the organizers. So I'm very thankful to Pawan sir and his entire team that have taken a very, very important topic for today's discussion about relevance of mental health care in Ayurveda. So in the next 20-25 minutes, I'll try my best to share few of my experiences in the area of the mental health. And that too, in the present scenario, when people are suffering with COVID pandemic, I think the mental health becomes more relevant. And because most of the people are either in anxiety, depression, or in fear, or in form of decreased sleep. I think more than the physical problem, people are suffering with these mental health issues in the present pandemic. So that is where probably Ayurveda can definitely help in the management of various types of mental health related disorders. So I'll be talking here is Ayurveda and the holistic mental health care. And as we all know that today happens to be the Mental Health Awareness Week. So in fact, it is not the Mental Health Awareness Day because Mental Health Day is generally celebrated on October 10th. So it is a whole week that is celebrated by the Mental Health Foundation of creating awareness among the common people about the mental health. So to start with, I'll just share the few of my experiences in the present scenario. I have been involved in the District Health Administration in the telephonic triaging of the COVID positive patients and also doing the telecounseling and consultation for all the COVID positive patients of our district. And you can see different types of people. We are able to interact with them and we are able to probably address those mental health issues. Maybe simple like the fear, anxiety, and they're really worried about their family, their health, etc. And if you can really give have few simple tips that we are there with you, don't worry, nothing is going to happen. And whenever you want have any difficulties, whenever you have any queries, please call us. We'll be there with you. I think these are the two important words really change life. Don't worry, we are with you. Probably this is a very, very important message that we can always give to the patients who are suffering with such problems. I think Dr. Vijayendra Bhatt is going to cover a few more aspects of what mental health has to do in COVID-19. So in this aspect, I will just give you one small self-assessment that you should need to do, because the theme for this year's mental health awareness is nature, and because we have to be connected with the nature, and it can be in the form of gardening or being with the pets, or going out for a walk in the park, garden, etc. This can play a major role. So if you can assess yourself or your mood, how was your mood before you could get attached with the nature? Like you can divide them in a rating of 0 to 10, from the 0 being the saddest and 10 being the happiest. And after getting connected with the nature, maybe walking, jogging, yoga, meditation, gardening, etc., how you are feeling after maybe 15 days or 1 month of being attached with the nature. And this you can always assess and feel that there have been a significant improvement in your level of happiness. And this need to be persisted along. See, before I go into a few more aspects, I'll probably take two important case studies, because the most important diseases that we come across in mental health is depression and anxiety. So I'm going to just give you two short case studies, and then probably we'll try to discuss more about that. First, we start with the case study for depression. See, this is a 32-year female who is from Hassan, came to our OPD with symptoms of sadness of mood, crying spells, disturbed sleep, and general weakness since 2 months, and has the lower mood as per a pre-moderate personalities, no history of hypertension or diabetes, but she has a conflicts with her husband because she was not able to give a birth to a child even after 10 years of marriage, and the husband was alcoholic and was having the physical violence with her, and also she was suffering with the hemiparesis or pakshagata. When we examined the patient was normal appearance, had a normal eye-to-eye contact, but her speech productivity was less, mood was sad, irritable, and there was anhedonia. The judgment and other perception was said to be normal. The doshas that were involved in the patients were Vatakshaya and Kaphavriddhi. The doshas were Rasa, and the Vibramsha was seen in Sangnyagnana, Bhakti, and Shila. Sangnyagnana is the orientation, the Bhakti is the desire, and Shila is the habits and the temperaments. So there was an impairment in this aspect. So what was the diagnosis? So diagnosis was based on the DSM criteria, where there was diagnosed as a moderate depression because there was depressed mood, loss of interest in day-to-day activities, reduced psychomotor activities, and as per ICD-10 coding, the patient was diagnosed with F32.11, which is moderate depressive episode. And when we applied the scale, which is commonly applied for depression, is Hamilton Depression Severity Scale, the scale was 14. And in Ayurveda, the diagnosis was Vishada or the Kafaja Unmada with Pakshagata, the stroke in resolution. So the treatment plan that we gave to the patient of Takradhara for 3 days, Shiropichu with Jatamamsi Churna and Amalaki Churna, the Sarvanga Udvartana, Panchakola Fanta. Then we start with the Snehapana. Snehapana, because it is Vata Kapha dominant condition, we use Panchagavigrita, starting with 30 ml till 250 ml on the 5th day. Then the Sarvanga Abhyanga with Mahanana Taila and Bhashvasveda, Virechana with Tirut Leha and Draksha Kashaya. And patient had 13 Vegas. And the Shamana Aushadhi that we gave only was Panchagavigrita. And along with that, I think there's one important yoga that we commonly use. It is a preparation of the Zandu, the Zandopa, which is common Parkinson's disease, getting excellent result in patients of depression. If we give 5 grams twice daily with 150 ml of milk for 4 to 6 weeks, we are getting very good results with the help of Zandopa of Zandu Pharmaceuticals. And also, we are also advising the patient to take Kushmanda Swarasa, like around 40 to 50 ml of Kushmanda Swarasa, the pulp with the seeds. Again, can be taken with sugar candy or honey twice a day in empty stomach for 4 to 6 weeks. You get very good results with the patients of depression. And along with that, we also did counseling, progressive muscular relaxation therapies, yoga, pranayama, and Trataka. And these were the combination of the therapies. And if you see the outcome after 30 days, so there was reduction in the crying spells, the mood was getting better, her weakness started getting better, and more than that, she was feeling much fresh. And when you applied the Hamilton scale again, From 14, it has reduced to 10 in a matter of 30 days. And there was no adverse effects by any of the treatments. So this is a patient's feedback because it's in Kannada. Probably I'll just tell in terms of the what patient was feeling, that the patient was feeling much better after this. So next case study was about the generalized anxiety disorder. A 30-year-old male came with complaints of persistent negative thoughts, palpitation, difficulty in concentration, thought block, and health anxiety since 8 years. And there was no comorbidity of hypertension or diabetes, but the patient had psychic conflicts because of the death of the uncle's death because of the cardiac arrest. And the patient had this anxiousness because of thinking that I also could suffer from the cardiac problem. On examination, patient was quite normal reaction. The speech productivity was normal. The mood was anxious, irritable, and restless. The perception and concentration was present, but the insight was present, but the concentration was reduced while we did the serial subtraction test. The dosha that was involved in this condition was Vata, Bhootavidya, and the Vibramsha was present. So diagnosis as per DSM-5 was generalized anxiety disorders. And as per ICD-10 coding, it was F41.1. And as per Ayurveda, it is Chittodvega. And when you applied the Hamilton anxiety scale, the anxiety scale was showing 27 in this patient. And the patient was diagnosed with moderately severe generalized anxiety disorders. The treatment that was given to this patient or protocol that was followed was Tailadhara with Kshirabala Taila, Shiropichu with Jatamamsi Churna, Amlaki Churna and Brahmi Churna, Sarvanga Udvartana with Parisheka, Chitrakadivati 2 TID after food. And in this patient, because it's a Vata Pittahara line of condition, we used Kalyanaka Grita from 30 ml to 300 ml, then Sarvanga Abhyanga with Mahanana Taila and Bhashpasveda. And then we gave the Virechana with Avipatikara Churna, and patient had 16 Vegas of Virechana. And the medicine that was given as the Shamanaushidhi was Manasamitravati and Sarastarishta. So these were the 2 drugs which were given for 30 days. And along with that, patient was given counseling every day. Then the muscular relaxation helps really well in cases of anxiety disorders, yoga, meditation, and the pranayama courses. So this is our new mental health unit. It's an exclusive 30-bedded mental health unit which is established in our hospital. We're very thankful to our management and our president, Dr. D. Virendra Hegdeji, for providing us a state-of-art facility and exclusive for Manasaroga, where we are trying to treat on the basis on principles of Ayurveda, and we are getting excellent results and feedback from the patients. And in this patient, follow-up, patient was reported, patient was sleeping better, the negative thoughts had reduced, concentration was becoming better, and patient was feeling fresh. And when we applied this scale again after 30 days, it has reduced from 27 to 15. Again, there was no adverse event that was noticed during the treatment. So if you look at the status of mental health in India, we can see that there should be at least 3 psychiatrists for every 1 lakh population. But at present, there are less than 0.3 psychiatrists for every 1 lakh population. As per the survey, it is said that more than 7.5% of the Indians are suffering from some or the other type of disorders. And this is going to rise to more than 20% at the end of this year. There are more than 56 million people suffering with depression and more than 38 million suffering with anxiety in India. And globally, India has accounted for 36.6% of the people suffering with suicides. And you can see yesterday we celebrated the Mother's Day through this platform, and it is more than the maternal mortality when compared with people who are aged between 15 to 19 years. And as per the global burden of disease conducted in 1990 to 2017, 1 in every 7 Indian is suffering from some of the other type of mental disorders. Even in other survey, it is said as 1 on every 4 people are suffering with some or the other type of mental disorders. And especially the people suffering with alcoholism and substance abuse is very, very high in India. See, there are so many myths about mental health, and that is why probably this platform should help us to create awareness among the people, because people think that medication in mental health can become addiction. No, if it is properly given under the supervision of the doctor, it doesn't become addiction. People are possessed with ghost, bhoot, vagera se. People are suffering with these different types of ghost, etc. And sometimes people see that by doing the marriage, the mental disorders comes along. And all type of mental disorders need to be hospitalized. In fact, only 20%, less than 10% people require hospitalization. Otherwise, mild to moderate cases can be very successfully managed in OPD basis. Just love and care can sometimes reduce. No, especially if it is severe mental disorders like schizophrenia, disorders, personality disorders, definitely it needs a combination of medication and counseling. Consumption of alcohol is important for reducing the stress. Stress can never be relaxed or reduced by alcoholism or any of the substance abuse. In fact, it will go into increase. There are a lot of brutal treatment therapies like shock therapies, ECT, etc. It is done in very, very minimal cases of severe depression, treatment-resistant depression, or sometimes of catatonic schizophrenia. But otherwise, there are a lot of therapies which are available. And especially when it comes to Ayurveda, there are a whole lot of external and internal therapies, herbs are available in Ayurveda, which can treat the diseases starting from pediatrics till geriatrics. So mental health do not signify a personal weakness. Person doesn't feel that he is weak. It also doesn't mean that one who is seeking the help is weaker. In fact, one should be very, very strong enough if you want to take the treatment. And the mental health condition can be cured by self-control, not in all. I think this was a very important discussion which we had in the late part of December 2019, when in BBC News and other Indian news said that Ayurveda has started treating ghost, and there is a ghost science in Ayurveda, because it was very wrongly communicated to the public about the term called as Bhootavidya. In fact, Bhootavidya has nothing to do with ghost. Ayurveda clearly mentioned there is nothing that invasion happens inside the body. See, Bhootavidya refers to all those causes which are external in nature, which are not visible to the naked eye, and which can affect the physical or mental disturbances to an individual. So it refers to all those minute causes which can be the leading causes of various types of mental disorders. So I think this is what one of the my student just observed, that one of the patient came with a very, very abnormal behavior, as if the god has invaded him, and he could see that there was a lot of psychological changes in the patients. And I just said is a classical case of invasion of Bhuta. Patient, he was really left clueless. But when you understand the basic concept that have been told in Ayurveda about Bhootavidya, we'll come to know that it's a science which talks about all those minute external causes which can lead to various disturbances. It could be microorganisms, it could be the various the external environment, external stressors, emotional stresses, which can be the cause for various types of mental disorders. So journey so far was very good, but after the corona, I think there are a lot of changes that we has affected the life. Starting from children, adults, or elderly, everybody's life has been affected by this corona. And I think especially mental health has been affected very severely by this condition, because people are already always worried, because either if he is positive, he's worried about that he could recover or not. If he has not been afflicted, he's getting the fear that he'll get afflicted. Somebody in the family is getting affected. Somebody in the family is dying. Somebody is getting severely ill. So it has, I think we all need to be really mentally strong enough, have that positive attitude to face this problem. Because everybody, sometimes it's problem with losing their job, economical problems, financial crisis. Children also are finding difficulties. And more than that, we are not getting contact. Everything is happening online. Like this webinar is happening online, no? But what the enjoyment that we have from person to person contact generally is missing. And more than that, more than 93% of the countries are the services related to the mental health is disrupted. So that is why people are not getting the proper care for their mental health. And if we can invest a little bit of amount in the mental health, it can give a great outcome. And that is where probably Ayurveda talks about the preventive mental health care. Like Ayurveda and traditional medicine system has a greater role to play in personalized and tailor-made treatment, because it is not just health for all declared by WHO 2000, because it's about not only just the universal healthcare, but each of us have or the awareness of health, and that is probably most important. And Ayurveda talks about it is not just the medicines Ayurveda talks about for mental health. It's a combination of four. See, when we're talking about the holistic mental health, it talks about the four aspects. There are diet, there is lifestyle advices, there is psychological support, and there are therapies and medicines available in Ayurveda. So mental health is a state where a person realizes his strength and is able to cope up with the stresses of life and can able to contribute to the society. See, it's all about how you manage your stress. See, problem is not with the stress. It is how you manage your stress, how you react to the stress becomes more and more important. Because stress is nothing but the imbalance between the demands and the resources. If the demands are high and resources are less, so that is where probably you will have the stress problem. And basically that is why either you should reduce your demands or increase your resources to combat the stress management. And what Ayurveda talks about the principles for mental health, this is a beautiful quotation that is there. Nityam hita ahara vihara sevi samikshakari visheshu asaktaha dataha samaha satyaparaha kshamavan aptopa sevi cha bhavanti aroga. Perfect mantra for mental health. Balanced diet, exercise, being analytical, sensory detached, being compassionate, being helpful for the people, mental equanimity, being truthful, have the sense of forgiveness, and respect your teachers and elders. This is what you can definitely do in the present scenario to come out of this problem. And out of this, there are a few important therapeutic changes that you can make. Take care about your diet, exercise, be in tune with the nature, and you'll always find the changes. So what are those foods that can help you to come out of this problem? Like there are simple medicines available in Ayurveda, water, milk, ghee, amlaki or gooseberry, daksha or the raisins, the kushmanda or the bitter gourd. Remedies that you can use for Ayurveda. And little bit of physical exercise, yoga, body exercises, aerobics, or you can always use yoga, meditation, etc. They all will help you for building your confidence, memory, especially the self-esteem. Your efficiency will be greater when we do a little bit of exercise. As per WHO, 20 minutes of exercise for 5 times a week will help you in coming out of this mental health alone. And very importantly, being in touch with the nature, because if you're because we're always in artificial environment, everybody in AC environment, in artificial everything. If you go in the nature, probably that is where it can help you, because if you're always in artificial environment, it will disrupt your mood, health, sleep, diurnal variation, etc. So always be in the nature, go out in the nature and find the most important part. And very important, present people are always into this media immersion, internet and media, etc. People are so much immersed. So you should carefully use this media and internet, etc., especially in children, because if they don't take care about their hyper usage of this social media, then it also changes a lot of changes in the brain. There's a lot of changes in their mood, habits, etc. So that is where, and the family support, the friend support in such type of corona time is very, very, because we're all emotionally attached. And suppose we have the family attachment, care by the friends, I think many of the people's mental health can be cured. And that is where we can always contribute. You can help the people, do some services, social services, help people who do not have food, help people who do not have medicines. Little bit of dana, if you are able to do, it will give a lot of satisfaction. It will give a lot of mental well-being. And there are so many medicines which are available in Ayurveda. We are doing a basic research on ashwagandha in comparison with HCQS, and we find that the ashwagandha is as good as HCQS in the patients of COVID frontline workers. We also did a research where we took more than 1,670 participants of different age groups. We found that out of 1,600 participants, 198 participants had stress, anxiety, and depression, and we gave capsule of Rami Churna for 1 month. And we can see that there was an enormous change in their mental well-being, the state of freshness. So in Ayurveda also, there are so many types of therapies from Panchakarma, Shirodhara, Abhyanga, Virechana, Basti, and so many herbs which are available. And if one can logically use them, I think it will definitely help a lot. So to conclude, the true mental health is not just absence of a disease. Mental health is a full expression of life. Jio khulke, jio aram se, and all this happiness, enjoy this world. And that is why this world is a beautiful place to live when you are happy, comfortable, and satisfied in the life. Because if you look at the old tradition way of exercise, food of our old grandmother, is what is a perfect thing in case of the mantra that can be told for mental health. Because people are thinking that for mental health, there is some pills or there's some medicines. See, there is no pill for every ill in mental health. So the mental health, the care, the come to the social support, family support, and some herbs if it's required. So that is where the diet and life will be the focus of the mental, physical, and public health in the future. And preventive mental health will be the main focus. Nutritional mental health will be the main focus of the future, rather than just managing the condition like depression, anxiety, etc. Once again, thank the organizers for these wonderful opportunities. And if there are any questions, I'll be very happy to answer. Thank you, sir. Thank you very much.
Excellent, Dr. Shetty. Excellent. You have covered all of the aspects of mental health, myths, facts, everything. Thank you, thank you, thank you. Excellent, sir. We will definitely trouble you in next webinar also. World Schizophrenia Day is also there. So I would like to request you to join on that day, World Schizophrenia Day. Is there any medicine for schizophrenia also? Please guide us. Thank you, thank you, thank you.
Sure,
Now I would like to request Dr. A.R.V. Murthy. Dr. Saab has joined us after long waiting. I welcome Dr. A.R.V. Murthy, sir. He is Principal, Dean, Superintendent of N.K. Jevsetti Ayurvedic Medical College and PG Center, Sri Siddharuda Charitable Hospital and Research Center, Siddharuda Math, Bidar. I welcome Dr. A.R.V. Murthy, sir. Welcome, sir. Your face is not visible, sir. Please reset the camera.
Any problem, Dr. Sharma?
Your voice is coming, sir.
Yes.
You can share content.
Any
Share.
problem? I don't know.
Share.
Share. Okay.
Share then screen one.
Screen one. Okay. Okay.
Then your screen will be visible,
Okay.
sir. Yes.
Yeah. Okay. 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 Okay.
Right, sir. You can go for slide,
It's
sir.
okay.
Yes.
Yeah,
You
yeah.
can go for
So
slide.
thank you very much. Yeah. I can go. I can just change because there's no problem with me. I can just go on changing one by one. No problem. So thank you very much, Dr. Sharma ji. I am really thankful to you for inviting me to the webinar. In fact, I had a very short time for the preparation. Yesterday night, I was sitting and preparing the slides. I thought that I should do this. Am I audible? Okay. Am I audible?
Yes, please
Hello?
keep mic near the. Yes, please keep mic near. Yes, you are audible, sir.
Yeah. Okay. I have made a small preparation for the presentation. You have been asking me for quite some time now. I thought that I can share you. Huh? Okay. ಇಲ್ಲಿ ತಗೊಳ್ಬೇಕಾ? Okay, as you have rightly introduced me, I am working as a principal at Ayurveda College, Bidar. Mainly my concern is that I wrote 3 books on Indian psychology. One is Psychological Consultation in Ayurveda, that was written in Sanskrit. Second, the Mind in Ayurveda and in Indian traditions. Third is Rationale of Ayurveda Psychiatry. These are the preparation, psychological books on psychiatry that I wrote. Let me start with something Anadimavi ಇದೆ ಅಂತದೆ. ಇದು ನಮ್ ಕಾಣ್ಬೇಕಲ್ಲ. ಅನಾದಿಮವ್ಯಂ ದಿವ್ಯಂ ವ್ಯಾಪಕಂ ವಿಶ್ವದೇಶಜಂ ತ್ರಿಕಾಲ ಉಪಾದಿತಂ ನಿತ್ಯಂ ಆಯುರ್ವೇದಂ ಉಪಾಸ್ಮಹೆ. This is simple about Ayurveda. So Ayurveda has been known to mankind for quite some time now. It is known for its well-founded concepts on sense and essence of life. The theme of Ayurveda was evolved by the great Indian seers who conceived, perceived, and propagated it purely for the benefit of the mankind. Considered as one of the oldest medical sciences, the origin of Ayurveda dates back to the age beyond 2000 BC. I don't want to go into these details. Next. You were asking me to give me some encouragement, a speech that motivate others. You see, Ayurveda is so simple for a particularly for the young generation that who may be observing, who may be participating in the side. I just want to make it Ayurveda is very simple. The medicines are simple, easily available, and cost effective. This is the most important thing about Ayurveda today, because for each and every medicine, people are spending lakhs and lakhs of their hard-earned money. So Ayurveda is very simple, easily available, and very cost effective. And the most important thing is it is devoid of untoward effects. Not only that, devoid of untoward effects, it has side benefits. A simple example I give you, the patient comes with amla pitta and constipation. If you give simply St. Madhu, it will take care of amla pitta. At the same time, it will also ease the evacuation. So this is the easing evacuation is an additional benefit that St. Madhu gives. This happens with many Ayurveda drugs. So not having side effects, and having the side benefits. This is one thing that Ayurveda should boast of, and everybody should be happy with that one. And it is natural, non-synthetic. It will use it for prolonged periods. The most important thing about Ayurveda is this: the patient comes with joint pains. If you use an allopathy drug, steroidal drugs, non-steroidal antibiotic drugs, use it for 1 week, it's okay. Afterwards, he starts getting gastric irritation. He needs some antacids. But for you, if you start giving ashwagandha right from the beginning, you use it for 1 year, nothing will happen. The patient will be happy. The pain, joint pain will be reduced, and no side effects. And so it can be used for quite a long period. And it is curative, eradicates the disease from the root. Everybody knows about this. And it is patient oriented, subjective, and indigenous. Very few shortcomings: analgesia, anesthesia, and surgery. We are not very comfortable with an emergency medicines and communicable diseases. And another, extinct literature and inadequate descriptions, controversial drug identity, adulteration, lack of drug standardization, and lack of objectivity, doubtful reproducibility sometimes. I was working on something like ancient concepts and current discoveries. I would like to just give a few examples, which will be certainly be very useful and very encouraging to the young Ayurveda doctors. So the description of plastic surgery was available in Sushruta Samhita 1000 BC, remained a myth till the surgeons proved it in the modern sense. Blood circulation described in Vela Samhita, I will come to the details, in 1000 BC was a myth till Horvath, 1600. So secretion of gastric juice and the digestion described in Charaka Samhita 500 BC was a myth till Paulo came to discuss about this. The traditional practice of inducting acquired immunity described in Charaka Samhita was a myth till Jannah. You see, we are Sushruta performing the father of surgery. The modern text considers Sushruta the modern surgery. You have a sloka from Vela Samhita. Hrudo raso nisarati tasmadeti cha sarvashaha sirabir hrudayam vaiti tasmat tatprabhavah sira. What example you want about the blood circulation? So people talked about blood circulation only Horvath in 1600, but 1000 years BC, Vela had already described this one. Even we have a respiratory physiology, Sharanga Samhita 13 AD. It is said that the air goes into the lungs and it comes out, and fresh air goes in and the air comes out. So I don't go to details of Ayurveda definition of this one. You see, concept of health. Concept of health, Ayurveda has always included the concept of mental health. It is, we have a different health definitions in the modern medicine and other sciences for health. One is a physical health and the mental health. We have a health where the concept of mind and even the soul are included. Ayurveda talks about this. Samadosha samadhischa samadhatu balakriya prasannatmendriya vanha swasthya vidiyate. It's so comprehensive. This cannot be there cannot be a better concept of health than this. Even the WHO has stated that this is the best concept of health as well. So when we talked about the mind, you see, these are the Ayurveda talked about the Vegas. There are two types of Vegas. One is Adharaniya Vegas, and another is Dharaniya Vegas. There are certain urges, the natural urges, which need to be suppressed, some which need not to be suppressed. One that need not be suppressed are Sharirika Vegas. But there are Vegas called as Manasika Vegas. Dharayettu Sada Vegan, Hidaishi Petsicha, Lobecha Veshamatharya, Ragadinancha Jitendriya. So the most important thing is that this is the concept of well-being, the concept how a healthy mind and a healthy society. So these are the Dharaniya Vegas. So Sadvrutta, the moral code, is the one thing that takes care of all this mental health. If you want to be healthy on your own, if you want society to be healthy, this Sadvrutta has to be followed. I just, it's a simple one or two references. Concept of cure discussed in Charaka Vimana 8, sloka number 89 and 90. The concept of cure is something beyond the comprehension of any science. Rugupashabanam Chiriropachaya Balavruddhihi Swaravarna Yogaha Abhyavaharya Vilasha Abhyavritasya Aharasya Kale Subject Jaranam. He is talking about certain things. If just because if a disease is cured, what does it mean? It means that first pain should be alleviated. If you had some pain in the chest, if you have some problem, pain in the knee, or if you have hyperacidity, it should be relieved. Shariropachaya, he thinks about nourishment of the body. Just not that the pain in the joints are gone, but the nourishment of the body. And Bala Vriddhi, he should improvement in the strength. Svaravarna Yoga, your complexion should become normal. He also talks about the digestion. You should have the digestive system should improve. He talks about sleep. You should get a good sleep. And he also talked about the mind. Mano buddhendriya sharira tushtihi. He talks about the mind and the body. So if you talk about the cure of a disease, it involves so many things. It is not just simply relieving pain in the joints. It is not relieving the pain in the chest. It is not simply relieving the congestion in the chest. This is where Ayurveda differs from other sciences. I don't go to this one. We have multiple approaches to treatment. Ayurveda is starting from a grosser one to very, very subtle points where the treatment needs to be taken care of. And that's why Ayurveda is more successful than in terms of treatment. Starting from Sharira to Guna and the Gunamsha. If you have disease, for example, if you have diabetes, you can treat the disease. Diabetes, okay. But once you treat if you treat a Vyadhi Viparita Chikitsa, you should see whether which dosha is involved. It is Vataja or Kaphaja. This is very important because diabetes, everybody takes metformin. That's not the treatment. You identify the disease, you identify the doshas. Once you identify the dosha, you go to the level of guna. Because there are gunas that are very important. Vata can be aggravated because both with Shita and Ruksha. When you treat a Vata Vyadhi, if the Vata is aggravated because of Shita, if you give Ushna, it may be okay. But if you give Snigdha, Shita will get aggravated. So if you have to, when you treat Vata Vyadhi, you should differentiate between whether the which guna Vata is exaggerated, either because the Shita or Ruksha. If it is Ruksha, you can give Snigdha. If it is Shita, you have to give Ushna. If it is because of Ruksha, if you give Ushna, Vata Sanchaya will take place. So this is the beauty of Ayurveda, that even in a disease, you identify the disease, you identify the dosha, you identify the guna, and even gunamsha. So therefore, the most important thing is Ayurveda has always talked about the prevention. You would not have been in the conditions of this corona disaster if you had taken care. If you are, am I audible? Am I audible? Hello?
Yes, you're audible, sir.
Yeah. So if we would not have been in the condition of disaster if we had taken such that little bit care to prevent the corona in second wave. And that's why prevention is better than cure. That's what Ayurveda always says. Second thing is treat the man as a whole. Now we are talking about corona. We are talking about black fungus. I don't know where black fungus has come. We do not know why it has come. You are treating corona, you are getting vaccinated, and black fungus has come out. You are not treating the man, you are treating only virus. I don't know where fungus has come, because you are only concentrating or treating the corona, and black fungus has come out. I don't know how many fungus will come, how many other diseases come. Avoid etiological factors. The most important thing is etiological factors should be avoided. If you are coughing, you get a cough, you get treated. But if you continue to smoke, where the cough will go, it will come back. So if you have an indigestion, you get treated with Chitrakadi, Lingostaka. But once you start overeating, Adhyashanam, Viruddhashanam, once again it will come back. So avoid etiological factor at all times. Give the drug as a whole. The most important thing is give the drug as a whole. Because we have seen how Sarpagandha works and Reserpine works. We had a lot of side effects with Reserpine because the active ingredient was taken out. But Sarpagandha, still today, it's not a problem. This reserpine is a problem. We have Brahmi was taken out, alkaloids were taken out of Brahmi and given to patients. But today we do not know what has happened to those chemicals. Brahmi Gudha still exists, but those all chemicals are gone. So they have, the drug has some ingredients which counter the side effects of the drug itself. And that is the beauty of the drug, and that's why drug should always be given. Panchakarma roots out the diseases. When the drug therapy is not successful, always go for Panchakarma, that will take care of the problems. Toxic metabolites are disease-causing agents. It is not that something else is a disease. It is not a virus. It is not a bacteria. Toxic metabolites, AMA are the disease-causing agents. If you prevent AMA, if you digest AMA, the problem is gone. Rasayana rejuvenates the body. Rasayana rejuvenates the body. After the treatment, after the Panchakarma, give some drug, give some Rasayana. That will care of everything. And the most important thing is, microbe is nothing, body is everything. Microbe is nothing, I repeat, body is everything. Today, virus is going inside the body and creating a problem. If the body is strong, even if the microbe is nothing. We have thousands of exposures daily. People get exposed to tuberculosis, but not everyone gets tuberculosis. If the body is immune, there is no tuberculosis. So microbe can do nothing if the body has everything in it. And that's why microbe is nothing, body is everything. I just speak for another 10 minutes the basic concept of therapeutics in Ayurveda. The curative therapy. I only talk about curative therapies. We have magico-religious practices, we have psychological methods, and physiopharmacological procedures. So non-pharmacological methods called the Daivapashya Chikitsa. They are called the faith therapy. We have Atharvan and religious, two categories: incantations, sacrifices, oblations, restrained acts, offering, talismans, and all. Everybody knows. Mantrauchadamani Mangala Valyupahara Homaniyama. These are things everybody knows. I don't want to go into the details. So ancient approach to psychiatry. I consider the four important aspects in this: psychological measures, non-pharmacological methods, physiopharmacological procedures, and specific drugs. So psychological measures, the most important of these things is Sattva Vajaya. In fact, this is on this that I worked out in 1984-87 when I was at Banaras Hindu University. I was asked to work on Sattva Vajaya in irritable bowel patients. My guys wanted that Ayurveda psychotherapy should be tried in irritable bowel syndrome, and Sattva Vajaya was the topic that was given to me. In fact, I was the first person who worked on Sattva Vajaya, and we had wonderful results in irritable bowel syndrome. I continued with on various psychological disorders. I was very happy. Literally translated, Sattva Vajaya Punarahitebhyo Arthebhyo Mano Nigraha. The most important, literally translated, the subjugation of ahitebhyo artebhyo. Withdrawal from the unwholesome objects. Ahita artha. We'll discuss for a short while. Ahiteb. Unfortunately, maybe that Charaka 500 BC or 1000 BC, Charaka discussed the concept of Sattva Vajaya, but no other text till Todara maybe around 17th century, talked about the word Sattva Vajaya. Aidebhyo arthebhyo mano nigraha dhidajatmani vigdanam Sattva Vajaya michita. That is what Todara says. It is around 17th century after Charaka, 1000 BC and 17th century, nearly 2700 years. Nobody used the word Sattva Vajaya. After Charaka, only Todara used this word. So we'll come to what Sattva Vajaya means. Sattva Vajaya means mind control methods. It can be categorized as mind control methods. It can be reconciliatory methods, replacement of emotions, psychophysical shocks, moral behavioral code, and mental equanimity. These are all come under Sattva Vajaya. So mind control, what exactly has to be done? I told you, ahitebhyo artebhyo mano nigraha. You have to, artha means it's a stressor. It's a stress. You have to identify the stressors. Identification of the psychophysical stressors. You have to identify the psychophysical stress. Ahitartha vignanam. Evolving techniques for dealing with stressors. Once you identify these are the stressors, you have to identify samvidhana prakalpanam. Evolving techniques for dealing stressors. Then clinical application of the techniques. You have to chikitsamaya anvayanam. You have to anvaya. You have to apply the clinical application. Then clinical evaluation of the utility of it. Once you apply the techniques, you have to evaluate whether the techniques are useful or not. So what are the psychophysical stressors? There are environmental stressors, ahitendriyartha, psychological stressors, ahita manortha, intellectual blasphemy, prajnaparada, and temporal vagaries, parinam. These are the psychophysical stressors. So what are the environmental stressors? Shabda, sparsha, rupa, rasa, gandha. These are ahitebhyo, artebhyo. The Shabda, Sparsha, Rupa, Rasa, Gandha, they are arthas. But they are when they become ahita in a particular context. You have to see what you should see. You should not see what you should not see. You should not see something at particular age. At a particular age, you are allowed to see. You should touch something at a particular age. You should not touch something at a particular age. You should indulge in certain things at a particular age. You are not supposed to indulge in certain particular age. And that is called as ahita is contextual. It may be related to age, it may be related to some other context. So when the when artha becomes ahita for you, you have to avoid it. So shabda, sparsha, rupa, rasa, gandha, all these things, when they become ahita for you in your context, you should avoid them. Ahitebhyo, arthebhyo, mano nidraha. What are the psychological stresses? Chintya, vicharya, muhyam, dhyayam, sankalpam evacha. Check out about 5 arthas. Chintya, vicharya, muhya, dhyaya, and sankalpa. So once again, chintyam, what you should think at a particular age. At the young age, you should think about your studies. At the once you come to Yavanavastha, you should think about vishayas. You should be you should get married, you should involved in those things. That's at that age. Once you come to the Vardhakya, you should think about the evolving yourself. This is Chintya. Chintya is a particular age, at particular stage of your life. Similarly, Vicharya, Mukhya, Deya, Sankalpa, all related to context. So these are the psychological stressors. Once again, they need to be avoided. Once again, ahitebhyo, artebhyo, manonigraha. Intellectual blasphemy, parinama. Asat mendriyartha samyoga. Intellectual blasphemy, prajnaparada. So Dvibhrama, Dhriti Vibhrama, and Smriti Nash is called a prajnaparada. This also should be taken care of. So temporal vagaries, over manifestation, under manifestation, Hinadi Mitsya Yoga. This is also should be understood in the context of prajnaparada, in the context of Sattva-Vajaya. So what exactly has to be done? Sensorial abstraction, identification of the objects, artha vignanam, discrimination, sattva, satya, sattva, viveka, gradual withdrawal, ahitarcha varjanam, regular adoption. So you should identify the objects which are ahita. You should differentiate the viveka, which is good for you, which is bad for you, and gradually withdraw. You withdraw gradually. Whatever you should do it gradually. Withdraw from the ahitarthas gradually. At the same time, regularly adopt hitopaseva, hita gradually. So promotion of the mental faculty, restoration of the intellect, buddhi samatva, regulation of the patience, dhruti niyamanam, revival of memory, dhruti prabodhana. This needs to be done. So self-regulation, regulation of the thought process, chintana saraneha niyamanam, logical disputation with the thought, chintitasya tarkika vadaha, speculation based on logic, tarkadharita vyuha, contemplations, speculated notion, uhyasya nididhyasanam, conviction on the notion convicted, nididhyasya sankalpaha. So seasonal regimen will take care of seasonal vagaries. So Ritucharya, for each ritu that has been followed to avoid signal vagaries. Once you come to clinical application, the most important is clinically you should apply sensorial abstraction, indriyartha nigraha, self-regulation, sriyartha nigraha, promotion of mental faculty, prajna pratipattihi, seasonal regimen, ritucharya. So clinical evaluation, you have to evaluate. Once you started treating, I told you concept of cure, rugupachamanam, indriyartha nigraha. So serenity of the mind, unimpaired intellect, spiritual happiness, sleep at the right time. All these things should happen if the treatment is successful. This is how you have to evaluate the clinical. You have to evaluate clinical evaluation: sleep at the right time, absence of morbid dreams, happy awakening, normalcy of the body elements, promotion of nutrition. This is Charaka Vimana 889. So mind control techniques. What are the mind control techniques? Both in Ayurveda and Yoga. Abhyasa Vairagyam Nirodha. That's what Patanjali says. Abhyasena cha kaunteya vairagyena cha grishyate. That's what Bhagavad Gita says. Ayurveda also talks about Abhyasa and Vairagya. Abstract orientation, Adhyatma Vidya. Regulation related, Pranayama. And association with the biases, Sadhu Sangati. These are the things that have been discussed in Ayurveda, discussed in the ancient Indian texts about the mind control techniques. So reconciliated methods, Ashwasanadaya. Therefore talks about in Unmada and Atattva Abhinivesha. It is that Ishtadravya Vinashastu, Yasya Manopahanyate, Tasya Tatsadusha Praptihi and Ashwasanadivihi. He says that he should give consolation. He should say that if something is gone wrong, okay, you will get it back. Your money is gone, after some time you will be able to get it. Don't worry. If something is lost, it will come back. That is called Ashwasana. Pacification or conciliation. And substitution donation. Something you got lost money. Okay, today you don't have money. You try to give him some help him with some money today. So he'll be happy. After some time he'll learn and he'll give back to you. This is important. And appropriation or gratification. Prasadana. So replacement of emotions. This is a very, very typical concept. Even my professor worked on this. I also worked on this. This concept has come in Jara. Charaka has discussed this concept in Jara. Kama, Shoka, Bhaya, Harsha, he talks about, I do not remember the exact words. He said that when there is a Kama, you should replace it with Dvesha. Yeah. If you have lust, for example, if you have lust for something, if you are you go on drinking tea, you are drinking alcohol, you are taking something, what you gradually replace it with Dvesha, you should get an aversion for that one. This is a very, very important technique that was used. Very, very important technique that was used by the ancient Indians. For example, the husband and wife, they're quarreling for something. Maybe for their own reasons. There is a dvesha, there is anger. What you should do is, you should introduce priti, love. What exactly you can do? You bring the child in between. Suddenly, immediately, the love change replaces dvesha. So replacement of emotion is a very, very important concept that was used by Charaka. It was used by ancient Indians in many concepts, and even today, psychotherapists use this. The technique is used. So dvesha, krodha, lobha, moha, mana, bhaya, shoka. Bhaya, when there is bhaya, you introduce courage by some means. These are the techniques have always been used in Ayurveda. Psychophysical shocks. Vismapana, Vismarana, Vitrasana, Vayatrasana, Adbhuta Darshana, Harshana, Pridana, Ishta Vinashakatana. These are something, suddenly you say something, suddenly terrify him, surprise him, demoralize him, annoying him, terrorize him, thrilling. These are certain things that have been discussed in Charaka in Unmada. This is a very important concept. What exactly happens is it is something like a I called a psychophysical shock. It is something like a electroconvulsive therapy. The patient, when patients see this, you give electroconvulsive therapy. What exactly happens is there's already the volatility in the electric currents in the brain. By giving one small jerk, everything becomes normal. Everything becomes all the electrical current, maybe this one and all, they become normal. That is the concept behind giving this. So psychophysical shock is also something like that. If you give a something like suddenly surprise him or suddenly you terrify him, suddenly the mind gets a sudden shock. So the balance suddenly comes back and the patient becomes all right. And even in Panchakarma also does the same thing for the body. Panchakarma also does the same thing for the body. If you give a shock to this your gastrointestinal tract, after some time, everything set right. And that's why patient becomes all right. So psychophysical shock in the form of Vismapana and psychophysical shock also in the form of Panchakarma can be helpful. So moral behavioral code I talked about earlier. The most important today is that we should become, most of the society has become immoral. Today what we need is morality. Sometime in 90s, a Japanese friend gave me a book. The book name was Morality. He wrote a book on morality. And something, it is morality is something that's not known to anybody. In the current scenario, only Ayurveda text talk about Sadvrutam. The only text, only books which teach Sadvrutta and Sadachara is Ayurveda text, nobody else. But unfortunately, the most of immoral things prevail in our own field. We are really sorry for that. I really feel sorry to state this also. We have to correct ourselves. We have to follow what has been said in the text. That will take care of many things. Ethical practices. Sadvrutam, Trivarga Syanvavekshana, Dashavida Papakarma, Dharaniya Vega, Prajnaparada, Sanmarga Vaktaraha, Tyakta Dharmanaha, avoidable men. These are all discussed in Charakas. And this is the moral behavioral code Ayurveda should learn, treat, and practice, and also preach. So mental equanimity, this is a higher state. Once you become Sadvrutta, Sadachara, you become Sadachari, then you can think of this. It is Dhairya, Dhi, Dharati, Smriti, Jnana, Satya, Buddhi, Samadhi. All these comes at a later state. Only thing is for that one first, the basic concept is you should become follow Yama and Niyama or Sadacharas. So physiopharmacological procedures, Yukti Vyapashraya Chikitsa. So purificatory measures and palliative measures, I don't want to go into the details. So Panchakarmas, you know all these things, Vamana Virechana and all. So specific drugs, the Medya Rasayana drugs. Specific drugs in the treatment of Mana Sarogas are Medya Rasayana drugs. Though they are said that Medya Rasayanas, they treat variety of, they are useful in variety of diseases. Shankapushpi, Manduji, Parni, Buduji, Sheshti, Charka talks about these four things. About as Medya Rasayanas, Shushruta adds many other things. Brahmi, Ashwagandha, Jadamamsi, Jyotish, Tulasi are also included nowadays. So Medha, Medya Rasayana is Prajna, Medha, Dhi, Dhriti, Smriti. So improving reception, retention, and recollection. This is the concept of Medya Rasayana. I don't want to go into the details. I just give a few recent studies that have shown that it makes Medya Rasayana very, very effective. What I am telling you is Ashwagandha was used by ancient Indian doctors, maybe around some 2,000 to 3,000 years ago. We even do not know actually the same Ashwagandha that was used or not. We are not sure that the same Ashwagandha that was used by our ancient Indians we are using. But today we are using something, we are calling it Ashwagandha and we are using it. And the same Ashwagandha is giving wonderful results. I was just trying to find out what exactly the mode of action according to modern medicine. So it exhibits GABA receptor mediation. It reduces convulsant activity. It offers neuroprotection against pilocarpine-induced seizures. Protects against PTZ-induced seizure activity. Offers protection against spread of alcohol-induced seizures. Protects against amphetamine-induced hyperactivity in rat brains. Inhibits morphine intolerance and dependence. Prevents rise in LPO, liquid peroxide, enhances SOD, superoxide dismutase, and anxiolytic, anti-euphoric, and anti-stress. You just see what are the actions of ashwagandha is exhibiting. And that's why ashwagandha, we use it for so many conditions. You see Brahmi, it enhances cerebral glutamate, increases protein levels in hippocampus, reduces the levels of LPO in hippocampus, depletes the noradrenaline and 5-HT content of rat brain. It has so many other activities. Enhances protein kinase activity. Shankapushpi exhibits anticonvulsant action, potentiates barbiturate hypnosis, produces cytoprotective anti-stress activities, prevents changes in neuronal cells in specific brain areas, and promotes learning and memory. Similarly, Jyotishmati, I don't want to go into the details. I'm just only reading it out. So, what has been said in Ayurveda so many years ago is valid till today. Only thing that we have to follow. The onus is on Ayurveda fraternity to reproduce and replicate the effects of these drugs and show it to the young Ayurveda, budding Ayurveda doctors. We have to induce confidence because so much has been said in Ayurveda. And we, as senior faculty, it is the responsibility of each and every one Ayurveda doctors to induce confidence into the young bloods by practicing Ayurvedic medicine, by showing the results in the way they should be. We should also take into confidence the other systems of medicine, because we have not been able to translate Ayurveda in the languages that they know. As I told you, ashwagandha has so many activities. We say ashwagandha, if you say ashwagandha is Vishadhara, if you say that Ashwagandha is Uttejaka, if you get something like that Brahmi, you talk about Ayurvedic drugs concept they don't understand. You have to say that what ashwagandha does. That's why I gave you example. That's why you should say what exactly Brahmi does. What are the changes it brings about? If modern doctors understand this, then they will realize that Ayurveda has so much. It is the responsibility of the senior Ayurveda physicians to take into confidence and speak the language of the other doctors, to communicate them in their language what Ayurveda has said. Then only we'll be able to cross the barriers. We'll take the confidence. We'll be helping in enhancing the confidence of our own people, and we'll also bring the modern scientific community into our own fold. Because I still remember in 1987, CDRI director had come to Tirupati when I was studying at Tirupati. Kamboj told me, when I was discussing, he told me, Dr. Murthy, we are spending crores and crores of rupees on research. If you want to identify one molecule that enhances the brain activity, we'll be spending crores and crores. Modern doctors should simply refer Ayurveda texts and study those drugs discussed in Ayurveda which promote the mental activity. Instead of screening thousands of drugs, simply go to Brahmi and search the activities of the Brahmi, and you will get the activities which you require. Because Ayurveda has already discussed all those things. So to identify the activity that you need, you need to refer to Ayurveda texts. The drugs have already been discussed, and you need not to thousands of drugs need not be screened. You can screen or 4 or 5 drugs that will give the required results. That was what he told me. I still remember. So that is why Ayurveda has been at the top, and we only think that If at all Ayurveda has to become popular, we should adopt these methods. Krishno hiloko buddhimatam acharya, shatruscha buddhimata. So Charaka said, the end. Mano badraha pratavo yentu sarvataha. Let us invite everybody. Let us invite the knowledge from all corners. Ultimately, samagram dukkamayatam vignani dvaya shreyem. Sukham samagram vignanam. Vimalecha Prakshtam. Charaka, at the end of the 30th chapter Sutrasthana, he said the last words. All cause of all miseries is ignorance. Either for the modern doctor or Ayurveda doctor. And knowledge removes all miseries and takes happiness. So thank you very much. Hope I have made my point.
Excellent, sir.
very much.
Excellent.
Thank you very
Very
much.
scientific, detailed description. Excellent. I would like to communicate my sincere regards and thanks to you, sir. Thank you, sir.
Thank you very much,
much.
Sharmaji. Thank you, one and all. Thank you.
Now I would like to request Dr. Dinesh. Dr. Dinesh. Dr. Dinesh KS. Dr. Dinesh Ji. Am I audible to you? Kindly unmute yourself.
Yes, sir.
Welcome, welcome. Dr. Dinesh KS is professor and head of the Department of Bhootavidya, Vedratnam PS Warrior Ayurvedic College, Kottakkal. I welcome Dr. Dinesh and would like to request to guide us.
Close ಮಾಡ್ಸಕ್ಕ ಈಗ ಅದು ನಮ್ಮ ಕಂಟಿನ್ಯೂಷನ್ ಇರುತ್ತೆ ಇದು ಕ್ಲೋಸ್ ಮಾಡೋದು ಕೂಡ
Welcome, sir.
ಇಲ್ಲ ಅಂದ್ರೆ ಇದೆ ತಾನೆ
Hello.
ಅವ್ರದ್ದು ಬರ್ತದೆ ಅಷ್ಟೇ
Yes, you are audible.
Okay.
ನೀನು ಹೋಗು ಇದು ನಾನು ನೋಡ್ಕೊಳ್ತೀನಿ ಮತ್ತೆ ಕ್ಲೋಸ್ ಮಾಡೋದು ಅಷ್ಟೇ ತಾನೆ ಮತ್ತೆ ನೋಡ್ಕೊಳ್ತೀನಿ ಇದು ನಾನು ಮಾಡ್ಕೊಳ್ಳಿ ನಾಳೆ ಬೆಳಗ್ಗೆ ಕಳಿಸ್ತಾರೆ.
Your screen is visible, sir.
Yeah. Hope my sound is clear and screen is visible to all. First of all, let me extend my sincere love and thanks to Dr. Pawan Kumar Sharma sir and all other office bearers behind this program. Actually, I don't know what was the type of audience or previously I asked, but I didn't get the clear answer. Actually, what's the style of audience and everything. So I was given with 15 minutes of time to present my views according to the organizers. So right now in my watch, it is 5:23. In within 15 minutes, I will wind up everything. So it will be a general thing because I don't know whether it was needed in a deep scientific manner in Ayurveda or in modern science or to the general public or not. The holistic mental health in children. This was the topic or this is the topic which I have selected. Since the last 16 years, I am dealing with in research perspective as well as in legal point of view. I am dealing with certain issues, mental or psychophysical or neurobehavioral issues of the children, such as autism spectrum disorder, ADHD, learning disability, such issues. So I will give you certain glimpses regarding the principle behind the holism which we kept in Ayurveda. I hope everyone in this audience are Ayurveda doctors only, it seems. See, to know the details regarding my activities, you can log in just my website, ethicalAyurveda.com, because due to the shortage of time, I will be able to mention only certain principles behind my practices. I don't know how many of us understood the real meaning of holism in terms of psychiatry, especially in the early developmental period of a child. Because every individual is different in different way. But the holistic view has to be kept in mind whenever we are looking into each and every child in connection with the following factors. A child is, or a human being is not only a composition of 37 trillion cells, but rather he is actually built with near about 120 trillions of microbes in his body. And he is living in a particular society, either in the family or in that given nearby society area, in a particular environment, in a given time and space. This is the actual holistic view what we need to keep while applying Purusham Vidya in every child, or individualization has to be done with respect to the time where we are analyzing the child or treating the child, the environment in which we are dealing the case, and the society from which the child comes or where he stays. Then finally you look into the child or the individual as such. Then only we will have the real-time application of whatever may be the principles of Ayurveda, either in terms of psychiatric management or in terms of any other disease management. This is not only applicable in terms of psychiatry. If you look into a special article written by Jennifer Rice, she is the non-BAMS holder, but rather she is a powerful Ayurvedist. One good cited article is available in PubMed, Nonlinear Dynamic Ayurveda. So you, if you are just looking into that article, you can have the more details of the minute, intricate implications of each and everything. And this is quite applicable whenever we are looking into different factors, whether it may be dosham, dushyam, belam, kalam, manalam, prakritim, vaya, or it may be karyam, karanam, or whatever may be our factors. If you are analyzing it, everything will coming under these four aspects of a given individual. Otherwise, we are dealing with the chaos. Chaos are actually special entities of in medical science. If you just read a special article which is published in the British Medical Journal, that is chaos, predicting the unpredictable. That is, it simply means that 1 + 1 need not be 2. It can be 100, or it can be 1,000, or it can be minus in human body. Because we cannot equate our biological mechanism in terms of mathematical equations. It will be just like a compound pendulum. You cannot predict its move. So you cannot generalize the principles of Ayurveda psychiatry in everyone. There should be an individualization because everything in the world is in an order. In that order, there is a disorder. For that disorder, there will be an order. So the mental health and the physical health, you cannot separate it according to Ayurveda principle. According to the Tafta Jekata Nyayam, it is complementary to each other. If you want mental health, you should have physical health. If you want physical health, you should have mental health. So life course approach should be adopted. Otherwise, what we are dealing in our hospital, a life course approach is the principle of the management, the early intervention from the preconception, gestation, and during delivery and early neonatal period. And healthy mind and healthy body has to be maintained. Prioritizing mental health while forming each and every policies. Avoid short-termism. Short-term goals should not be kept, especially in children's case. mental health equity in all policies, in all hospital policies, whatever may be in NABH, or it may be any other hospital guidelines, or it may be a social guidelines, a mental health equality in each and every policy should be kept in mind. So daily good food, daily good activities of daily living, take middle way approach in every issues. These are the take home qualities what we teach to each and every family or each and every child in the holism of mental health perspective. So good food, good dinacharya, and take midway approach in every issue, sarvadharmeshu madhyamam, and don't get so much attached to anything in an inseparable way, and be a giver always. Be truthful, be compassionate, be loyal to elders and others. These are the take-home messages what we are always trying to instill in each and every child after finishing, especially the 21 days of life course approach of management in our mental sanatorium. This is actually the quotation given in Ashtanga Hridaya, Nityam Hidahara Vihara Sevi, Samiksha Gairi Vishaya Dada, Satyabaraha Chamavan, Aptoba Sevi, Vishayeshwa Saktaha. So, what I want to say these principles, it is very easy. But we are having some SOPs, standard operating procedure, how to instill each and every this quality in a growing child, and how to instill a proper environment in the family so as to be adopted by each and every family members in that environment. So these are the practical difficulties while instilling these programs in holistic mental applications. So styling the family for mental health is very important, because without styling the family members, you cannot achieve these goals in children. So in addition to Ayurveda drugs, training of the parents, yoga to the whole total family members, and Ayurveda teaching Ayurveda standards of living. These are the main syllabus and curriculum what we are keeping while dealing with the subject of styling the family. Even we have conducted a lot of researches by comparing, or otherwise by taking the WHO QOL brief, the quality of life of the each and every family members will be taken before styling the family and after styling the family. Even with the family styling, the child will have a lot of improvement even without a treatment. That is the peculiarity of this Ayurvedic approach. So in addition to Ayurveda drugs, training of the parents, yoga, and Ayurveda standards of living, these are the prime components of the syllabus and curriculum in styling the family members. In that scenario, we have conducted an observational study, analysis in our center, where children are getting all these facilities like the treatment and everything. We started this study among 321 parental figures, but 249 has responded. This is the Venn diagram. Hope you people know the peculiarity of the Venn diagram in statistics and in its expression. So the question was, why you have opted Ayurveda? See, majority of the parents unfortunately believe that minimal side effects for Ayurveda treatments. That's not majority, but a good percentage. Even though it is not right, but people have such belief. Other conventional treatments not seems to be much effective. This is highly subjective feeling, but still they feel like that. And Ayurveda treatments are effective, they feel like that. And other reasons, there are several other reasons. And why are you doing Ayurveda continuously? Because even though they treating, we have the facility to stay here for a long 1 year because our courses are for minimum for 6 months and maximum according to their wish. So usually the parents are staying here with their children at least for 1 year. And they are taking all the therapies, psychotherapies, physiotherapies, and occupational therapy, speech therapy, behavioral therapy. This is the style of our management. And 84.8% of the people obtained their improvements in child's condition with Ayurveda treatments. At least it is not worsening the child's condition with treatments. According to advice of the consulting doctor, okay, the doctor advised. That's why we are continuing. These are also opinion, not in less percentage, but near about 40%. There are other non-medical reasons are also present. And why are you discontinuing Ayurveda? There are some people who discontinued. We inquired the reason. Most of the people are having some non-medical reasons. That is very important in our Indian culture. Because non-medical reason, most of the time, the whole family, they cannot confine here for 1 year. Either there will be one parent and one child will be here for 1 year, and they will be, they left their family and they are staying here. This is one big reason. That is the reason why, because we have started a new venture that in every district, we are supposed to start one center each. At least they have to come or at least they will get the access to their own districts to get these facilities of all these holistic training programs and treatment program. So worsening the child's condition with Ayurveda is also present near about 2%. Don't forget it. Anupachaya is also, it is there. Even though no improvements in child condition with Ayurveda treatment, 33%. They are discontinuing without the improvement also. That is also there in this Venn diagram. So all these are highly subjective, not in accordance with the objective parameters. So my point is, even though the people, Ayurveda people are keeping holism while managing the diseases, we have our own duty and responsibility that we should make it evidence-based in front of the parents, in front of the society, in front of the common man's perspective, that how much it is reliable, how much it is effective, how much it is holistic, and how it will be beneficial in comparison with other conventional therapies. That's all. And this is the style of work what we are giving. If you need much more about the information regarding these procedures, you can just consult into the ethicalAyurveda.com, and there is one provision of one question answer session in that website, or you can put your own voice that you will get right answers without having any other additional expenditure. And our major programs are Agastya and Ayukam training programs. Agastya means Ayurveda drug, Gender therapy protocol, Ayurveda standards of living, training of parents, and yogic assistants. By this, I am ending up because it's sharp 5:39 in my clock. So thank you one and all for the patient hearing, and thank you, Sir Basar, for your kind invitation.
Excellent, excellent, Doctor. Well in time, well in time. No doubt. You are really salutable. My regards to you. Thank you. Thank you for your nice explanation, nice guidance. I will trouble you again also for my different webinars. It is a guidance for Eastern India and Northern India, no doubt. Now, before inviting the last speaker of the session, I would like to request my younger brother, Dr. Prashant, to communicate his sentiments on behalf of Jandu, what we have for our mental health faculties. And then I will invite Dr. Virjendra Bhattji for his motivational speech. Dr. Prashant Bagal.
Type I.
He is medical marketing executive based at Mumbai. Doctor, here maximum persons are Ayurvedic doctors. So Ayurvedic doctor, Dr. Prashant Bagal.
Thank you, sir. Thank you, sir, for your warm regards. And I will thoroughly thanks the today's speakers for their valuable experiences that they have shared on the dice of Zandi Mami. With regards to the mental health, so we are having currently a few products in our kitty which we are offering to the doctors. So one such product is Brento tablet syrup that we are having. It consists of Shankapushpi, Brahmi, Ashwagandha, Yashti, Pushkara, Vacha, Sarpagandha and Jatifala as important ingredients. As you all know, there are a lot of ingredients into it. But we are the only company which are offering Sarpagandha because very few companies are there who are offering Sarpagandha into their formulation. It is useful in general mental debility, cognitive dysfunction, decreased vigilance, lack of concentration, age-related memory impairment, and loss of memory. It can be given in adults as well as in children. 1 to 2 tablets twice daily in case of adults and 1 tablet thrice daily in case of children or as directed by the physician. Second product that we are having in our kit is Zandopa, which is one of the research product on behalf of we are having only one single ingredient into it, that is Macuna prunus, which is also called as Kauncha. 87% is the extract. Usually what happens is a lot of companies do manufacture Kauncha as its singular herb, but what we have done, we have cultivated a special variety of Kauncha which could give more than 4% of levodopa, which is required in the case of patients who are suffering from Parkinsonism. Obviously, Parkinson's is a disease in which only allopathic medicines like carbidopa or levodopa are available into the market, but we have provided a potent Ayurvedic solution in the form of Zandopa. Third product that we are having is Saraswata Rishta. Obviously, it has been written into the text by Ayurveda physicians itself of past. That is, it increases the Dhruti, Smrti, and Medha. So that is one of the kalpas that we are having. So I would just request each of the doctors who is seeing this webinar to prescribe our products, quality-based products on the behalf of Zendo, Brento, Zandopa, and Saraswata Rishta. So this was a short gist of the products on behalf of mental health from my side. Thank you, sir, for inviting me and giving me my valuable time to share views regarding Zendimami products.
Thank you, Dr. Prashant. Now I would like to request Dr. Vijendra G. Bhatt, Associate Professor, PG Department of Kai Chikitsa in Manas Road, SDM College of Ayurveda, Udupi. I welcome Dr. Bhatt and request him to motivate us.
Thank you, sir. Thank you. Hello, am I audible?
Yes, you are audible.
I'm to the team Independent Research Ethics Society for inviting me to this very esteemed company which is hosting this program on the topic of holistic mental health, Ayurveda in holistic mental health. I'm very glad to get to share this platform along with the Professor Suhas Shetty, Professor A.R.V. Murthy sir, Professor Dinesh K.S. And once again, special thanks to Pavan Kumar Sharma sir. Now, I shall begin with the topic. Hello. Slide, sir.
Yes, visible. It is
Okay. So Ayurveda, mental health care. Mental health. What is mental health? Why the holistic approach is needed? That we shall just glance about that. Mental health refers to cognitive and emotional well-being. Cognitive about the thinking and decision making, that power, and behavior. Behavior is how we react to the other person, and emotional well-being, what we feel with the situation. Mental health can affect daily living, relationship with others, and even physical health also. So that is why a holistic approach is needed for the mental health treatment. By considering a person as a whole, not only the symptom of a disease. So it is a combination of a body, mind, and spirit, all the three. Mental disorders means the disorders which are having the abnormal thoughts, which leads to perception problems, emotion problems, behavior, and relationship. When it hampers, it considered to be the mental disorder. Some of the examples like depression, bipolar mood disorder, schizophrenia, and other psychosis, dementia, and developmental disorder, including autism. Why we need to give so much importance for these mental disorders? Nowadays, the prevalence rate is alarmingly increasing. So the depression is around 250 million people globally, whereas bipolar 45 million, schizophrenia 20 million, dementia 20 million, development disorder 80 per 1,000 children. This is an alarming prevalence of the disease, hereby increasing, and the psychiatric modern times, the term is by German physician and mental health. Medical treatment for the soul. But the thing what happening is now day-to-day life, right from the childhood, each and every child is also encountering the stressful life. It may be because of the computational education. It may be family, some problem issues may be, or some comfortable issues with the school, with the friends, maybe, or teachers, everywhere, even family members. Right from beginning from the childhood, even in the adulthood also, people are much more stressed because of target-oriented occupation. And stress is right from the beginning of the childhood to even the old age also. One or the other stress will be there. Each and every person is encountering stress, which may lead to the physical, emotional, psychological strain. The main, all this family or educational or the occupational stress, nowadays one more major stress is accompanied, that is because of the pandemic era. This pandemic era, people are so much stressed because of the influence of the medias. Whenever the people look into the media continuously to get updated, they start searching for so many things. And whenever they watch the negative news about the death, maybe statistics of the morbidity, mortality rate, and unavailability of the oxygen, maybe unavailability of the bed, all these negative news will induce so much stress in the people, and people will start beginning with so many symptoms of the anxiety. If you look into the symptoms of anxiety, even increase in the blood pressure, increasing in the blood sugar level, hampering the lipid profile, dyslipidemia, and palpitation, insomnia, depression, and variation in the immune power. These all are the result of anxiety, because anxiety is going to hamper each and every system in the body. Just one person when get anxiety, stressed, all his systemic functions will going to vary. In fact, the morbid symptoms are going to produce. And if it persists for days, months, then the all pre-existing disorders will going to shoot up. The central nervous system will release excess hormones, stress hormones, that is adrenaline or cortisol, leading to depression. Cardiovascular element may end up in coronary syndromes. People who have already some GI infection or GI symptoms, constipation maybe, or anorexia, may end up in IBS in long term of anxiety. Respiratory ailments with the COPD may be asthma. Patient if get anxiety, and if it continuously persists for months together, then he will end up in exacerbation of this condition. And remember, even immune system also going to deplete because of the anxiety. In such condition, viral infections are likely to happen, and even vaccine may not work at that particular moment of the state of anxiety. If anxiety persists for hours together, days together, then the injected vaccines also may not work up to the expected range. And apart from that, all the systems are getting involved. Apart from that, the simple anxiety may turns into various other disorders also. The major psychotic disorders like social anxiety disorder may result if the person is continuously exposed with the humiliated condition. Maybe in the office, maybe in working places, if he is continuously humiliated, then social anxiety disorder may begin. And if the person is affected with the traumatic condition, then he may possess post-traumatic stress disorder. If his thought become distressed because of the influence of various social media, then obsessive disorder may origin. When he get failures in avoiding particular situation, then phobia may develop. Terror or impending doom may result in panic disorder. Anxiety, if it is left untreated for months together, it may ends up in schizophrenia also, as the studies reveals. But what if the person is taking the anxiolytic drugs or the anti-psychotic drugs for continuously for several months? In fact, the advanced contemporary system provides for emergency conditions only. It is meant for acute condition and emergency condition. But when it is given for or intaken for longer period, then it has been proven to create a lifetime of physical and mental damage, as a fact ignored by the psychiatrists. Common and well-documented side effect of the psychiatric drugs includes mania, psychosis, hallucination, depression, depersonalization, suicidal ideation, extrapyramidal symptoms, diabetes, hyperglycemia, metabolic syndrome like the blood pressure or dyslipidemia, and gout, neuroleptic induced deficit syndrome, cardiac arrest, stroke, and even sudden death. These all are the expected and ongoing side effects of the antipsychotic drugs when it is continuously intaken. Then what is the solution? Solution is these whole things are happening because of two main things. One is pandemic situation, which are exacerbated by the media. People are trying to update it. People who are crazy about various word like modern, the word like early diagnosis, the crazy about the update and super specialty. These all people will end up in various problem when they have continued with the emergency medicine for longer period. That is one thing. Second thing is ignorance about the natural and time-tested, time-trusted Ayurveda. Because first ever Mano Vijnana description is found in Bhagavad Gita, in Mahabharata, even in the Sandhi Parva of the Mahabharata, while talking to the all kind of Arishadvarga are the saying when Kama, when the person desires for something that is Kama, when he did not gain that, then Krodha develops. When he gained that, he will desire to have it, not losing to that. That is Moha, Kama, Krodha, Lobha. When he, even after getting that, he will have the desire to have much more and much more. That is Lobha. Even after having much more, he won't want to lose it. That is Lobha. When the other person is also getting similar advantage, then he develops Matsara. Kama, Krodha, Lobha, Moha, Mada and Matsara. When he attains all the things, he will get the Mada. And when other person also starts getting that, he will get the Matsara. This whole thing has to be counteracted. And sorry. Hello.
Yes, please. Please tell me.
Yeah. Oh, okay. The slides are visible, sir?
No, not at present. Earlier it was visible.
Okay. Sorry for
Is there
disruption.
any technical problem, doctor?
Yes, I think.
Share content, screen 1. Yes.
I think now the slides are visible.
Yes.
And apart from the Mahabharata, even in Ramayana and various the Panchakarmas, like Chandogya, maybe Kathopanishad, these all very nicely explains about the mental health and to overcome all this. Next, moving to psychiatry in Ayurveda. In the definition of the health in Ayurveda, it is clearly mentioned that prasannata of Atma, Indriya, Man. Then only health is defined. If the person is having satisfied mind, then only. Apart from that, Sushruta has defined a separate branch of psychiatry. Detailed explanation of the symptomatology can be seen in Ashtanga Hridaya. In addition to the mental disorder and vivid description seen in the mind, its pathological state the factors influencing the development of the mind, 16 types of normal personalities, and examination of the mental strength, etc., is clearly mentioned in the Charaka Samhita. The personalities, examination, and influencing factors, these all are explained in the Charaka Samhita. Idealistic treatment procedure for mental disorders like Yukti Vipashaya, Daiva Vipashaya, Sattvavajaya, etc. are detailedly explained in all the Samhitas. So Yukti Vipashaya is a rational logical treatment, Daiva Vipashaya is a divine and spiritual treatment, whereas a Sattvavajaya is a mind control or a psychotherapy. There are a lot of Medhya Dravyas are explained by all these major Samhitas, especially like Mandukaparna Yoga, Shankapushpi Yoga, Yashtimadi Yoga, Guduchi Yoga, Ballataka Yoga, Haritaki Yoga, Indra Rasayana, Brahma Rasayana, and all, Vacha Yoga. As we know, even though the Manasa dosha considered each and every mental disorders are also cannot be go away from the influence of Sharirika dosha. All the diseases essentially have Sharirika dosha and coexist in Manasa dosha as it's a predominant underlying causative factor, and they are strongly interrelated too. Dosha effects on physical, emotional, and social functioning of the individual leads to cognitive as well as behavioral changes. As it is clearly mentioned, the doshas having the predominant action on medha, buddhi, dhairya, everything, and it is motivated by vata. Now, having said about the theoretical aspect of the psychiatry or mental health in the Ayurveda, we also need to prove many of the this one the treatment aspect which are evidenced, whatever to say, evidence-based treatment to be provided to the society. In our PG department of Yoga and Manovidyana in SDM College of Ayurveda, Udupi, we have carried out a number of clinical trials as a part of dissertation work under the as a part of the dissertation work under Rajiv University. So a clinical study, one of them is to evaluate the effect of Saraswata in Vataja, and we found a very interesting result, like concentration level has improved, sleep has enhanced, headache disability index scale showed very nice result, and encouraging result even in a perceived stress scale also when Saraswata Reshta is provided for a period of 30 days in the patients of tension headache. And one more clinical study where open clinical trial on the effect of Shivagudika in essential hypertension. When we carried out the trial on the Manovikara present over the hypertension and treated with the Shivagudika, very result like blood pressure also has reduced by 20%. Apart from that, Hamilton anxiety rating scale shown very excellent result. Effect on headache also very effective. Giddiness, irritability, palpitation, fear, and depressed mood, as well as disorientation is also has controlled with the Shivagutika when it is provided for 3 months. These all are a notable point because if our medicines can counteract under giddiness, irritability, palpitation, fear, and depressive mood, anxiety, then obviously it can act on all the psychiatric ailments. which are in the moderate level. Hello, am I audible?
Yes, you are audible.
Slides are visible, sir?
Yes, yes. Kindly
Okay.
continue.
Yes. Overall assessment when the Shrikandasava is provided in Madate order, very interesting and encouraging result we got like tremors, anxiety, agitation, excessive sweating, headache, and visual disturbance also, sensory organ also improved a lot when it is provided for 3 months continuously. Shrikandasava also having a very good result on alcohol use disorder. When Unmada Gajakesari Rasa is trialed in Unmada with special reference to depression, we have noticed that intensity as well as frequency of Mano Vibrama, Buddhi Vibrama, Samya Vibrama, Samya Jnana Vibrama, Smriti Vibrama, Bhakti Vibrama, Sheela Vibrama, Vachika, Sharirika, and Achara Vibrama, these all have reduced to very significant extent. It is meant to say that if Mano Vibrama, Buddhi Vibrama, Samya, Jnana Vibrama, Smriti Vibrama, and Bhakti Vibrama, Sheela Vibrama, Ashta Vibramas are controlled, then you can control any of the psychiatric disorder, but depends upon the severity. Obviously, we can counteract the moderate level of all the psychiatric ailments. When the Hamilton Depression Scale also provided very encouraging result, about the feelings of the tendencies, insomnia, and anxiety, agitation, and various other psychological factors are very much controlled with the Unmada Gajakesari Rasa. Sharvishturna, when it is trialed with the patient with the Srikara Bhavadushti, that is premenstrual dysphoric disorder, then we have witnessed that mood swing, sudden sadness, hypersensitivity, irritability, anger, tension, anxiety, depressed mood, hopelessness, sense of out of control, sleep disturbances, easy fatigability, these all symptoms are very much reduced and patient become better, almost around 50% or a little more than that when it is provided for 3 continuous months. A clinical study showed the effect of a Saraswata in children with the intellectual disability. Then it is very encouraging the result we got like Meda, Smriti, Dhriti, Jnana, Krodha, Shoka, and Harsha. These all psychological factors are very significantly controlled. Even adaptive functional disability status ABES rating scale also shown very nice significant result with the same medication. Functional academics, maybe social domain, leisure, self-directional, practical domain, and communication skill also has been improved in the children. It is proven that our all media rasayanas have effect not only on psychological factors, it has a good effect on all the systems also. As earlier, Professor A.V.R. Murthy sir said that we have not a side effect, instead we have side benefits lot many. Not only on psychiatric aspect, it is even in all the systemic functions also. Now, having said about the practical hand-on experience on the Medya Rasayana, in this COVID situation, I would like to once again remember you all to maintain the hand sanitization, mask, and keeping distance. And we all know that only up to 80 to 85% of effectiveness we can obtain all the things are very perfectly maintained. Apart from that, even the vaccine also can assist us up to some extent in enhancing the immunity in us. But everything has its own limitations since strains of the genes of the virus will keep on changing. So the real-time vaccination is, as said in our Ayurveda, waking up in early morning, doing physical exercises like walking or running, jogging, and doing various physical exercises which can expand the lungs, even yoga asanas, and doing pranayama, and drinking warm water, doing the Kavala Gandusha as explained in the Ayurveda, and steam inhalation, and having the nasya at least with the anuthaila or with the pure ghee or pure coconut oil, at least 2 drops to both the nostrils. And along with that, a very minimum dosage of Ayurvedic herbal kashaya, Ayush kashaya. Otherwise, our Zandu Pharma is also providing the churna powder. It can be made use to provide the or prepare the kashaya. Otherwise, we have seen that people are having a fist of black pepper, 2-3 inches of this ginger. Many of the drugs in excess quantity should not be. Only 1 or 2 black pepper or 1 pinch of the powder of that, and 1 inch of the ginger, 1 clove of the this one. This much is enough to prepare for 1 dose for 1 person. This kind of dose for twice a day is more than enough to enhance your immunity. We know that even though we may have the second wave strong, nearby nations like Sri Lanka, maybe Pakistan or China, Bangladesh, no other countries are suffering with this. And many of the West Indies maybe or China, all they have come out from of the their traditional herbal medicine only, along with the steam inhalation and warm water drinking and gargling. So the same thing has to be continued. Should not be panic, and should not be get affected to the media. Only be positive with the doing helps to other in sharing the real knowledge, and the help needy person in terms of the food maybe or medication maybe, be with the positive thinking. So Ayurvedic secretary was highly developed during those periods, and later there was a severe decline in this field. It had later turned to be something like witchcraft or with the interest of Western only. On 1960 onwards, once again, Ayurvedic psychiatry has been improved. So integrative treatment with the holistic approach of Ayurveda is the need of hour, and it will improve the mental health significantly. Once again, I'm very much thank for the providing me this platform for the team, Independent Research Ethics Society, and Pawan Kumar Sharma sir and team. Thank you, one and all.
Thank you, Dr. Vijayendraji. Thank you. Nice presentation based on the facts and data analysis. Excellent. I would like to communicate my sincere thanks to all experts who have accepted our invitation on short notice and explained well, nicely explained. Every speaker is authority of the subject. I must communicate my regards to all, and audience also for patient hearing. Dr. Sadanand Patri, Dr. Prashant Bagal, Dr. Samir Chaudhary, everybody, Dr. Ashok Kumar Dubey ji, and Dr. Vishnu Prasad Sharma ji. एक विश्व आयुर्वेद परिषद के बिहार के अध्यक्ष हैं, एक हमारे असम के अध्यक्ष हैं, प्रेसिडेंट। मैं विष्णु प्रसाद शर्मा जी से रिक्वेस्ट करूंगा कि वो अपना एक समापन भाषण हम लोगों को। डॉक्टर शर्मा जी। डॉक्टर अशोक कुमार दुबे जी, आप सुन रहे हैं मेरी आवाज? शायद मेरी आवाज ऑडिबल नहीं है उन लोगों तक। बहुत बहुत धन्यवाद। मैं फिर भी वेबिनार में मिलता रहूंगा। आई विल इनवाइट यू अगेन सर, बिकॉज you are the authority of unique subject, no doubt, and that is very essential for human being in this pandemic. No doubt, mentally everybody is feeling depressed, everybody. So now what will be the future, I don't know, but God bless us, God bless our family, God bless our circle. Sarve bhavantu sukhina, sarve santu niramaya, सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखात् भवेत्। Thank you all, sir. Thank you very much.
Thank you so much, sir.
Thank you.
Thank you.
Is there any question from the audience before concluding the session? If anybody, any expert from the audience can ask any question from present speakers. I don't think so, because everything has been nicely explained. Thank you. Thank you again. Thank you very much. Good night.
Thank
Take
you.
care.
Thank you so
Hari
much.
Om.
Thank you. Thank you.
Thank you very
Hari
much,
Om.
sir.
Hari
Thank you very
Om.
much.
Thank you. Thank you, sir. Thank you, Shetty ji. Thank you.